Not every day is a woman able to get pregnant.
That's true. There's a system that works, and
Right.
it happens to every single woman. As long as you're having a period, then
Right.
there's a time that you're ovulating. As I said, if you're ovulating, you'll have a period. Most of the time, ovulation will be followed by a period because of how the hormones work.
Right.
So there's a balance between the brain and your reproductive organs, and that is the ovaries and the brain. So you have to have the balance of those hormones. You have an egg in your ovary, and it has to go through the uterus to either come out or to get fertilized.
Right.
So, and this takes around 28 days in most people. 28 to 32 days, that's the average of most people. They'll fall within that.
This is the Muthembwa Show.
Well, hey, everybody. Good morning, good afternoon, good evening, good day, good middle of the night, whatever time of day you are catching this show. You are catching us on YouTube. Thank you for watching the playback. You're here on the live on the gram. God bless you. Thank you for being here. This is the Muthembwa Show for those of you that are here for the first time. My name is Muthembwa, and this is the ongoing series, The Joys and the Woes of Singlehood, where we get to talk about all the joys and all the woes that singles go through, and especially Christian singles, okay? And tonight is no different. We are bringing you an amazing show. We've got the amazing Dr. Karen Muthembwa all the way in Nairobi, Kenya. She's going to introduce herself.
Oh, thank you so much, my dear. I really appreciate this. It's an honor to be here. First of all, before I even introduce myself, I'm very excited, and I'm looking forward to our discussion, in the next couple of minutes. So my name is Dr. Karen Muthembwa. On my gram, I'm known as Dr. K. I think Dr. K is easier for you guys to reach out and have a conversation with me. I am a resident in obstetrics and gynecology. What that means is obstetrics is any woman who's pregnant. I'm the doctor for that woman, right?
Yeah.
And then gynecology is a non-pregnant person who needs any kind of treatment when it comes to their reproductive area. My specialty is in sexual and reproductive health.
Right.
That means I deal with everything to do with your reproductive areas when it comes to healthy sexual behaviors, use of contraceptives for all women, men, young girls, young boys, anyone who needs any form of reproductive health consultations. Yeah, I'm also the founder of Dr. K Foundation, which has a lot of functions. I encourage people to join, the foundation group, and also see it on my Instagram, where you learn a bit more. But basically, we teach sexual and reproductive health, different age groups. The young group, which is the under 21-year-olds, because the discussion I have for those ones is different from what I would have for an over 21-year-old.
Right.
And then we have the over 21-year-olds who are also very important. And in this case, we involve both men and women. So we are not just for ladies only.
Right.
Yeah. Right.
Amazing. Amazing. Yeah. That's so good. That you guys are intentionally, and I say you guys because I have watched a couple of your lives. Okay. And by the way, let me give a big shout out to Minister Carrie Kagiri, who's the person who got me to know about you, in the sense that when I did that show with her, Life After Breakup, you then found out about me and followed, and I was going through my followers and I was like, who is this doctor? What an honor to have a doctor follow me. So yeah.
Yeah, it was a very good, I was on partly, and then I was able to communicate with Karen. She was telling me about you, so it was a very good surprise when you sent me a message. I was like, yes,
Yeah, yeah, absolutely. Absolutely. So, wow, thank you. Congratulations. And like I was saying, like, thank you so much for being so intentional with making all this information available. Because, you know, earlier I said to you that for us as Africans, there's a taboo about speaking about these things, right?
Yeah.
Reproductive health, or even what exactly, like for example, my last guest, I had a guest on here last week Saturday, the wonderful Tito Lua, who suffered vaginismus for I think a year. You know, having gotten married, she didn't know she suffered this condition until she got married, and she could not consummate her marriage. You know, we talked about how for many of us as Africans, we frown upon the whole idea of talking about sex, about sexual health, and things like that. And I said, parents rarely, you may get a parent that might open up to their daughter, and usually it's something like this. Wait. Nikuone. Let me see you anywhere near boys. And that's as far as it goes.
Yeah. It's unfortunate, you know. It's very interesting, and you're right to say that in our tradition, because it's our tradition, that we experience a lot of difficulties when it comes to discussing things to do with sex and reproductive health. You know, it's not even just sex. People don't even talk about their health with anyone. Like maybe there's an issue down there, nobody is ready to talk to you about it, especially when they need you to introduce you to a gynae. No one says anything about it. Look at people who are walking around with prolapse, something called uterine prolapse. It's just down there because it doesn't hurt them. It doesn't do anything. They know something is down there, but they don't go to the hospital. People with cervical cancer, they have issues down there, but they've not been tested. They've not gone to the hospital. Now they come when things are really, really bad. They're going into kidney failure and all those things. That's when we talk about it. So it's not just about sex. It's about reproductive health as a whole, which you're right. And I think we need to break that today.
Yeah. Yeah, we need to. As a culture, you know, and I think, you know, to give credit to our parents, especially the past generation. I mean, you know, we thank God for our parents, and we thank God for what they were, they represented. But I think it was mainly because they also did not know any better. So they couldn't really, and also it may have been seen like a thing that was like they're endorsing sexual you know, promiscuity sort of thing going on. So it was best to, if we don't talk about it, hopefully it'll just go away on its own. Right.
But
until a daughter comes home and she's pregnant, you know, and then all of a sudden is, how did that happen? I'm like, how did you think it happened, Mama? I'm like, you tell me, you know, sort of thing, right? But anyway, listen, I mean, we're already having this conversation, but for the benefit of that one that is catching this show and not too familiar with, when you say reproductive health, just what exactly is reproductive health, ma'am?
Okay, so let me first describe what health is. Because even as much as we say reproductive health is, not everybody understands what health is. So health is a state of being okay. Let me just use that easy word, not just physically. So you have physically you're okay. Spiritually you're okay. Economically you're okay. Socially you're okay. Mentally you're okay. Now, without even, you know, because most people think that health is about your physical being only, but all these things come together to play together in making you, giving you your state of health. So, for example, if you don't have access, because you don't have money, you don't have access to the right foods, then your body will suffer. if your mental health has an issue, you're probably having a lot of stress, a lot of issues, then you're likely to develop an increase in your cortisol level, which is in your body, and then you develop things like hypertension and diabetes, just because you raise your stress levels. So all these things work together. So it's not just physical health. So we're talking about health as a whole. And now when you say reproductive health, it means we're talking about reproductive is that ability. If you're being reproductive, you have the ability to create another being, same as you. So what are these things that create another being, another one like you? Is if you have a healthy body physical system, which is now the uterus, we're talking about the ovary, we're talking about fallopian tube, we're talking about the cervix, the vagina, all those things are part of the reproductive system. Not forget the brain is also part of the reproductive system. And then we talk about the liver and the other things that work together to make sure that that particular area that carries the baby is healthy. So your whole being is still part of your reproductive system physically. But we also talk about your mental health. How is your mental health affecting your reproductive system in terms of if you're having stress or if you're under medication because of depression and anxiety or even diabetes, it can actually affect how your eggs are produced in your body, and that can affect your fertility. So this is all together. So we're talking, and then again, there's also the sexual part, which is very important. If you want to reproduce, you again have to have a healthy sexual relationship. So it's all together. So that's what it means to be having a healthy reproductive system. It's complex. It's not as as simple as people think, that it's just down here and that's it. No, it is everything together.
Amazing. Thank you so much for that, Dr. Karen. That's really, really insightful. It's just a whole lot of more information. Who knew that the brain was needed to be part of the whole reproduction?
Very important. Very important.
Right? Like,
when we talk about hormones, it's all coming from the brain.
Yeah. There you go.
The brain.
Amazing. So now, CS, I have to ask, and as you know about my show, being that we are, this particular series, not necessarily the show, we talk about other things besides the joys and the woes of singlehood. But for the benefit of this particular series, the joys and the woes of singlehood, and there's some sisters that obviously they're looking to transition from singlehood to married life. So can I just say, for that sister that is saying, I'm going to be getting married, in a couple of weeks, in a couple of months, what can she do to make sure that she's going into her marriage healthy reproductively?
Wow, that's a very, very, why it's a very good question, and it's mostly people don't talk about it. You're right. And people just go into it without necessarily knowing what exactly they need to know about themselves and their partner before they get married. So we have, I'm assuming we have a lady of any reproductive age, so I'll give it in general because I know that there's ones who are younger, there's those who are older. And in fact, there's some who also get married when they're already in their postmenopausal, So this is, a woman, it's important for you, at least it's good that you notice that you need to at least know yourself first and know what really your reproductive health means and what state you are in. So in such a case, I would advise her to at least get to watch these things that we do. First of all, some of the information we give, they're very, very helpful, but it's important to have a conversation with your personal gynecologist or a personal general practitioner or a family physician who's able to talk to them what and the questions we would ask, of course, first of all, when we see you, we ask you questions about when do you intend to get married, what date is your wedding day. That's very important. We want to, yes, because again, we also need to know when your cycle, because it depends on whether you want to conceive immediately or not conceive immediately. If you've ever tried to conceive before, whether there are any fertility issues, because people are different. There are those ones who are going to marriage, even, like for sure, that you have been straight, you've not done anything, you're a virgin. When you get into marriage, then at least you don't know whether you're fertile, but you believe that you are fertile. That's the right that you can always work and start with prayers, and your mental health is very important when it comes to fertility and
Absolutely.
all. But yes, but we definitely have to ask questions around that. Have you ever had an abortion? Very hard questions, but it's important to find out, because some of these things need to be known in case we need to work on you before you try to conceive or what. Then most of the time we will do a physical examination. This is when you see your gynecologist. And when we do, and in fact, before I even go into the physical examination, there's more into the history that we would need to know. How is your family? Your nuclear family, or your nuclear being your father and mother, because you're not yet married.
Right.
How is it? Do we have any conditions that we need to know about? Things to do with fibroids, because they tend to go into families. Things to do with ovarian cancer, breast cancers, things that you need to know so that you can be tested for. Well, it does not change anything about your wedding day or marriage, but it's good to, at least because you've been seen, we do that comprehensive examination. Things to do with if you have any children, when do you intend to conceive? Do you want to conceive on your wedding night? And if you know the wedding date, we will need to know when was your last menstrual period, and is it regular? Because if you have regular periods, we know that you could have ovulated at some point, So an ovulation is equal to, most likely, you'll have a period after that. When you ovulate, you have a period. So if you have a regular period, you're most likely ovulating every month. But if you have an irregular period, then it may mean that time that you didn't have a period, maybe like the 3 months that you didn't have a period, you didn't ovulate, which there could be reasons behind that. Which is amazing. It's good to know, because as you're going into marriage, the expectations, but the first expectation should be from you. That's what I always tell the women, that it's important to know what you want. Don't think about what other people want. It's about yourself. And at the same time, it's important for your partner to be present with you even before marriage when you're doing these discussions. But I know many people would probably want to see the gynae first. I don't know for what different. Maybe it's here only in Africa. It's only women come. But it would be very important to know that. So your regularity of your period might describe whether you have an ovulation or not. Then again, we want to also predict. If you're able to get a regular period, you can be able to predict your next period, if it's going to be on your wedding day, or there's sometimes you don't want to have your period during your wedding day. Because who wants to have a period during that? So we are able to work with you so that you can be able to either postpone it or have it earlier. So those are the preparations that one has to have. And when we do a physical examination, it's good to know yourself. Examine from head to toe, because you can tell us a few things about you. For example, just on the face, if you have acne, if you have hirsutism is growth of hair in where it's not supposed to grow, like in women. If you have a mustache, or if you have hair growing just below your chin, and you have acne at the same time, and your face is a bit rounder, then we are wondering, is this because you've had something called polycystic ovarian syndrome? But not to scare anybody, because some cultures have more hair than, some people have more hair than others. Being Asian, Asian of the Indian community, you're most likely to have more hair, even on your hands. You might have even hair full beard. Okay, not really full beard. But just because it's in families, and including being African, Black African, you're likely to have more hair, or like a bit of one, you see one hair growing somewhere, that can be normal. So it's not to scare you if you have a bit of hair somewhere, but sometimes when we look at you, we're able to check and compare to when you tell us about your period. If it's irregular, then we can put things together and help you through it before you even get married, or we can work with you and walk with you during that time. So physical exam is head to toe, very important.
Yeah.
We're able to pick, very, very important, you know?
Yeah.
And then of course we need to know your mental health. How is it? How are you getting into this relationship? I know we're not mental experts, but we know these things happen to our women. Right. So we all the time. And in fact, sometimes a woman can come to you because her issue is fertility, but when you look at the family history, or maybe let's talk about vaginismus, maybe she's tried before and it just didn't work. Right. And when you look back into her history, you realize that there was probably something that happened when she was during her childhood that made her have this psychological issue when it comes to sexual relation. Right. You know, so this is when we become a bit of mental experts when we're discussing some of these things. Yeah. So as I said, it's holistic. So we need to know how your mental, and even for yourself, it's good to ask yourself, who am I? What am I doing? This relation, what am I doing? Is this relationship correct? Is it right for me? Is it in good time? Because you also have people who are affected by religion when it comes to religion, not spirituality, but religion. You believe that sex is bad, from the teaching that you've had in your past. When again, sex was created for reproduction, and it's there, it's not a bad thing, but it depends on the time that you're doing it, because that's everything has its own time. There's a time, a season, and a time for every single thing that we do. So people get confused when it comes to what is ethical, what is not, that affects your reproductive health in very many different ways, So it's important to know yourself even before, we can help you, but it can only come from you. So those kind of things I would encourage, that young woman who wants to understand, am I from another relationship and then did I rush into this one? Because that can happen, and then you pull all the problems into this new relationship because you didn't get to heal your heart before you got into it. So it's a lot. Maggie, I can talk so much, so it's not
this is good. This is good. I had a little giggle under my breath when you said your cycle and when you're getting married, or you're looking to conceive immediately. And I said to you, you know what? I'm going to share with you a story and ask you a question, because you're kind of like answering that question right now. Because I said to you, sometime back when I was pastoring, I had this married lady come over to me and ask for prayer for conception, because she felt she was barren. Okay. And I was like, okay. And as you would in ministry, you go to the Lord, and I'm like, Lord, we need a spiritual diagnosis here. Okay. Because if she's saying she's okay, that she's okay, the doctor's okayed her husband's okayed her, okay, then this could be beyond what meets the eye in the physical. Is this a spiritual situation, Lord? Do we need to be breaking some curses here? Do we need to get into spiritual warfare? Right. I'm just kidding. But obviously spiritual, warfare and all that. And I remember going to the Lord and just speaking to the Lord about this, and I was like, Lord, what's up with this sister? She can't seem to get pregnant. And I didn't hear much for a couple of days, and I kept pressing at it. And I will never forget when just the word cycle was so loud in my spirit every time I prayed for her. Cycle. And then it dawned on me, oh, her cycle, as in her period. Yeah. So I said to the sister, you have a period, right? She said, yeah. I said, do you know when you bleed? Like, do you know the last time you bled? And she's like, yeah. When did you last have sex? So a lot of people don't understand that there is a cycle. There is what we call an ovulation period for a woman. Not every day is a woman able to get pregnant.
That's true. That's so true.
So here she was thinking she's barren because guess what? She and her husband were getting together outside her ovulation window.
And she didn't know at all.
She didn't know. She didn't know.
It happens.
It happens. So we had to sit down with her calendar and circle the days. And when and I'm like, please, would you explain? Because you being the doctor here, help that sister explain what exactly or when can they calculate their ovulation period, especially for those that are interested in getting pregnant. And because there's some married women on here who are watching us, and you'll be surprised they do not know this stuff. Because like I said earlier, unless you paid attention in your high school biology class, you may very well have missed that. Because if you're coming from that generation where your parents did not tell you anything about sexual health and being pregnant and all that, and all your mother told you was
hapo, usionge, don't talk.
You should know. If you're African, you should know. By the time your mother does this, you should know what that means, right? So for the benefit of that one that does not quite understand ovulation, sis, talk to that sister.
Yeah, so it's actually, it's surprising to most, but for us, we've seen it happening where people don't even know that they should be having the right intercourse. It happens as well because the way you do it also matters, because if you're not having penetrative intercourse, then it's less likely that you conceive. Wow. Yes, you've heard of people also having non-penetrative conceptions.
Yes,
that can happen as well. Yeah. But there are those ones who are just fertile. They're just fertile, waiting for this sperm to just go up there. But there's a system that works. And it happens to every single woman. As long as you're having a period, then there's a time that you're ovulating. As I said, if you're ovulating, you'll have a period. Most of the time, ovulation will be followed by a period because of how the hormones work. Right. So I'll give it I hope it will be easy, but I hope they will understand. So, but I usually try to simplify everything. So as I said, the hormones that come from the brain.
Yes.
And these hormones go to the reproductive system. So that balance of the hormones into your brain and your reproductive system must be balanced, so that you can be able to have your regular cycles. We thank God. It makes when you do medicine, you realize, when did God sit down and when you do creation, what? So many things are happening at the same time. He's above our thinking, And it's amazing, when you do science, you learn that science is not necessarily separated from what God gave us all these things. That's why we're still discovering them. Yeah. So there's a balance between the brain and your reproductive organs, and that is the ovaries and the brain. So you have to have the balance of those hormones. So you have some hormones coming into your ovaries, and then the ovaries produce some hormones, which when you look at the egg, you have an egg in your ovary, and it has to go through the uterus to either come out or to get fertilized. So, and this takes around 28 days in most people. 28 to 32 days, that's the average of most people. They'll fall within that. And when I say 28 days, it doesn't mean that every time your cycle will be exactly 28 days. There's an average. So it can come 27th day, it can come on the 29th day. So that is regular, because some people don't understand what irregular means. Regular versus irregular. So regular, it means it comes at an average of that 28 days or 32 days, but most people will fall in between 28 and 32. And that's just how our bodies work. Now we do have those ones who have less days, and we have those ones who have more days between periods. So you have the 21 day, every 21 days, that's 3 weeks. Every 3 weeks they have a period. And the other ones who have the 35 days. But beyond 35 days, then that's too long. You know? Yeah, that's too long. At least if you know that you're having a period more than 35 days, then that's a bit too long. You may just want to see your gynae for, check up and see whether everything is okay. But as long as you're having it doesn't have to come every month, because look, let me give you a calculation. If your days are 32, averaging 32, 33, then it means if it's January and your first day of your period was 1st of January, then it's gonna come on 1st of February, the next one.
Right.
So the first day is your first day of your period. That's day one. So day one is your first day of your period. Then you calculate 1, 2, 3, all the way to 32.
Yes.
So it means it's going to come in February 1st, on February 1st.
Right.
Then the next one will come when February does not have 30 days. It has, it only has 29 days and sometimes 28.
28, right.
Yeah, so it means your period will go to March.
Yes.
Right? But it won't come on the 1st of March. There'll be a change in that date. So there are people who think that if I don't get my period on the 5th of May, 5th of every month, then there's something wrong.
Right.
No, the body does not know months. It does not know February, it does not know March or April, but it knows the cycle. My cycle is between 28 and 32 days.
Right.
So it means if you have a 28-day cycle, your period can be shorter.
Yes.
So you have 2 periods in a month.
Yes.
Yes. January is, you start on the 1st, then the next one starts on the 28th. If your period comes again every 28 days.
Yes.
So it means you have 1st and 28th of January. So that's not bad. That is okay. That is okay. That's your regular period. So if you're having more than 35 days, then it's good to get someone to look at what, your period, because it could be sometimes shorter, sometimes longer. It may not have any regularity to when it comes. You cannot predict it. And when it comes, even after a long time, you're having heavier than normal periods, then something could be going on in your body. So this is where now we come with an average of where our fertility comes in.
Yes.
So if you have, so I hope it's not complicated. I'm trying to make it a bit
yes.
So if when we expect your fertility to be is 2 days, at least this is maximum, at least should I say high chance of conceiving, to be 2 days before your 14th or 15th day and 2 days after your 14th and 15th day.
Yes.
But this is for people who have a 28-day cycle.
Okay.
So if you have a shorter cycle, like around 21 days, then it means fertility period moves earlier.
Yes.
Yeah. So let's say if you have 21, let's use 21 day cycle.
Yes.
It means you have to divide your cycle, you'll have to subtract around 7 days prior to that. And then around that time, after your period, on the 7th day, all the way to that, minus, you subtract 7 days from the 28th day, right? Yeah. 21st day. Around that area where it's on the 7th day of your period, that distance, that number of days in between, somewhere in the middle you conceive. Right. So it's not exact for everybody, but it's important to know that around the mid-cycle, if you calculate your days and you know your days are 21 days, so it means from day 7, this is now in general for everyone, from day 7 of your period, that means it's day 8 onwards, all the way to day 21, you're likely to conceive.
Wow.
This is on average.
Yeah, of course. On average, giving people an idea so that nobody is miscalculating or basically calling themselves what they're not, because like I said to you, that sister was like, she thought she was barren. And that's a big word. That's a big word. But the good thing is she has 3 boys.
Wow.
She has 3 boys. I don't know about her wanting to have a girl, but she has 3 boys as we speak right now, which is amazing. Glory to God for that. Now, you touched on contraception.
Sorry, before I continue. Continue. It's very interesting to know that even for those people who are generally normal, a normal couple, what we consider normal as medicine, for us to say there's a problem with fertility, then we need to take at least 12 months before we say there's an issue. Wow. Because again, people have many things they're doing. They live far from each other. Their intercourse is not as regular as you expect. In fact, you should be having at least 3 times a week, every week,
Okay. Yeah.
Right, for you to say, I've tried, you know. So intercourse is very important. So you'll find people who live far from each other, maybe long distance, or maybe their work schedules are different. So you find if you're a doctor, and there are two doctors, for example, you have your night shift and day shift, you don't have time for each other. So you miss that fertility period, because that fertility period is very short for most people. So we don't expect you to conceive always, you know, as expected, like, you know, within the first few months. So we wait for you. Just try without thinking too much about it, praying about it, because at the end, by the time you're 12 months in, you should at least have conceived. But if you're above 35 years of age, you should conceive within 6 months, because again, there are other things we look at, you know, when it comes to age and conception and, you know, all those kind of things. Yeah. So most people don't know that they need to have intercourse for 3 to 4 times every week. Yeah.
Amazing. That's so good. That's so good. It's funny you say that, because just yesterday I saw a post from one of my a guest that's been on here, and she had posted a video from Steve Harvey show.
I've been married for 20 years. Out of those 20 years, me and my wife have been intimate together twice a week, never missed in 20 years.
Come on, boy. You got my undivided attention.
Now, I'm 59 years old.
Yeah.
And my wife she likes to have a good time. But the question is, I'm getting tired, Steve. So what's your advice that I can tell her? Now, let's cut this down to once every 2 weeks.
You've been doing it like this for 20 years?
20 years.
I got sorry for you, man. You got to keep it up. You can't go back. Yeah.
But basically, the guy was complaining that, you know, he's starting to get old. This was not for, you know, them trying to get pregnant, but it was just for intimacy between husband and wife. And he was saying for the last 20 years, they've been having sex twice a week, every week for the last 20 years. And he was like, I'm 59. I want to, you know, slow down. And Steve Harvey was like, no, you can't. You need to stay where you at.
It's probably why you're at 50 with your wife.
So to hear you say, you know, for those who are, you know, looking to conceive, and you know that there's a need to be, you know, sexually active at least 3 to 4 times a week, and then of course paying attention to that window of ovulation, you know. Absolutely. Now, speaking about contraception, this is one that a lot of ladies who, you know, again, in ministry, you have people come over to you and ask questions, not because I'm a doctor or anything, but, you know, these are just the things that that get thrown at you, right? And I had a lady come up to me and say, well, we don't want to have a baby as soon as we get married. But I'm also scared to go on the pill, because I'm afraid that if I go on the pill, when I'm ready to have a baby, to get pregnant, it won't be possible because the pill will be in my system.
Yeah.
Help that sister. Help that sister.
There's so many people who believe that. Yeah, that happens a lot. We do have people who probably don't understand how contraception works.
Okay.
And they believe that, and it's all hearsay. People talk about it. That's why I love women, just to debate a bit, because women will always go and give information. And if the information is right, then we're passing right information all over.
Yeah.
And if the information is wrong, then unfortunately women tend to still pass that same information like wildfire, and it goes all over that contraceptives are bad, or contraceptives are evil. You know, some like maybe others will be like, oh, this contraception goes to the heart, or Well, it doesn't even have any explanation as to how that happens. So yes, I think that's a very valid question,
Yes,
because it's a bit worry, because if you don't understand it, then it's a bit difficult to know what's really happening. So for her specifically, it's good to know what contraception is divided into many different things. There's natural, and there's the one that we add.
Yeah.
So even the natural contraception is still a version of contraception.
Okay. Which
And that is, like if you decide to count your days,
okay,
that's a form of contraception, right?
Yeah.
For the younger ones, my form of contraception is abstinence, because we are not ready for this.
Right.
We are just not ready for it. Not ready physically, emotionally, economically, in all ways. The health part, I say, yeah.
Mm-hmm.
So abstinence is also a contraception. That's again a particular age group, and if you're not yet married, right?
Yes.
And then if now in this case where you have you're at this stage where even deciding to do the pull-out method, some people do it as a form of contraception where there is no medication or anything that's given, but highly it fails. It fails. Fails. I would not lie. So that's the truth.
When we say the pull-out, like I said, girl, we're gonna be so raw. When a man does not ejaculate inside his wife. Okay.
But that doesn't work at all, so I don't recommend it. But anyway, so there's the natural, and then I said calculation of your days. You can use bead system. So there's a bead like a chain that helps. If you have a 28-day cycle or 28 to 32 days, actually 28 is best, because most people are around that area. So you just calculate. Every day you move the bead. There's something that you put over. It's like a small rubber band on top of the bead. It just moves to the next, and then to tell you this is your fertile period, because the beads will change color. And then the time when your period starts, that's day 1. So it's a very easy way of, if you have only for those people who have regular periods. So that's still a form of contraception. So it's not just medication that's contraception. So now when we come to what we do for you, because maybe you don't have regular periods, or you're having difficulty in terms of managing your choices when to do this, maybe your hubby or is not ready to assist or not listening to, because you can tell him this is my fertile period, but no, he's still gonna do it. So we have no choice but to still do it, and then you get pregnant, and that was not the plan. So this is when we now use different methods, and I'll tell you they're divided into hormonal and non-hormonal. So you still have another choice of choosing if you don't feel like you want any hormones, which is not a bad thing, because these are the same hormones in your body. So we're not adding any other type of hormone into your body. We're just adding into what is already in you, but trying to control how your periods and how your days are, and preventing ovulation. That's what hormonal contraception do. But when it comes to non-hormonal, because which are easier, because there are those women who come and say, I don't want any hormones in my body, and that's fine. That's a good thing, is that you can choose. You actually choose what you really want. There's no one that fits all. So if you want the non-hormonal one, then it means we give you options like the intrauterine contraceptive, which is called the IUCD or copper device, or you can use the hormonal version, which does not take the hormones into your body. The hormones remain in the uterus only. So this one will not go into very little goes into your body. It may not change anything. It's the same hormones. So it will just be treated like any other hormone in your body. So the one that's fully non-hormonal is the what we call coil here in Kenya. It's called coil because it has coils around, the copper coils. And so that one, when we put it inside the uterus, it stays there even up to 10 years. And guess what? When we remove it, your fertility goes back to normal. So you don't stop having children. So the IUCD is a very good one. You don't have to think about it. It's inside. It's just there. You can have intercourse. The only thing is that after the first few weeks of putting it, you might still want to use condom before it peaks. before you prevent pregnancy completely. Yeah, so that's important for people to know, because once you get the coil in and then you have sex the first 2 weeks, your chances are there of still conceiving, but it's rare, right? It's very rare, but it's important to just know. So we give you all the information, right? So that's a copper coil. It's very easy. You don't have to remember. You don't need to remember that one.
Right.
Then you have now the condom. Is also non-hormonal. It's called barrier method, used if you want to prevent pregnancy and plus any sexually transmitted infection. Like in the case of people who are married and they have one is HIV positive and the other one negative. That happens also quite a bit. We do have a lot of discordant, we call them discordant couples, where they, whenever they're having intercourse, they just have to use double method. Double method meaning you have the condom and you might also use another form of contraceptive in case the condom bursts. And it's a whole discussion. That's a whole discussion on discordant couples. And you know how to keep yourself not.
You know, we should have that conversation because, sis, there are people who are living with HIV/AIDS.
And it's, you know, people, you know, we just need to discuss it because that's a whole topic on its own. How to still, you can still get pregnant together. So there are different ways of managing it, getting medication, and to be honest, I believe in healing as well. So I always say you can get, your faith can treat anything. You know, so it's possible. We need to still tell them what we know because it's just the truth. That's just the truth. But those ones who, you know, because what I say about medicine and disease, it's important to know that we all have different levels of faith. So because if you can have as small as a mustard seed, it means you can have a bigger version, right?
Absolutely. Or even that's just enough.
There are levels, right? So if you know that you're not yet there, you're a child, you're still growing, you're learning, then still it's good to still have your doctors recommend medication as you continue building your faith. So that happens. We still have discordant couples who are still being managed and they can still conceive together. It's still okay because everybody has a right. So we encourage them to use the condom, which is a barrier method, prevents from STIs and also from pregnancy. And if you're using date system, like where you're calculating your days, then from the days we've talked about, like from day 8 all the way to 21. But remember, in between, if you have a mid-cycle, 2 days before, 2 days after, that's the time, high chance of getting pregnant. You might want to use a condom during that time, and especially if you know your partner is not ready to stop or will not stop and will continue. Right. So, the hormonal ones are, hormonal ones are quite many. We have the one that you take orally, which is a combined pill. You take it every day as long as you know that you're good at keeping time, making sure you take you have to take the pill every single day. Because most of the ones that we have formulations here in Kenya, and I think it's the same thing even in the UK, that you don't necessarily stop on the 21st day of your pill taking to have a period, is that it still continues with iron pills. So you don't have to remember you stopped on day 21 and then you should start again on day 28. No, you just continue taking it. It's so much easier that way. So up to from day 1 to day 21, you have the ones with the hormone, and then from 21 all the way to 28, it's just iron pill. So, but it just, you know, it replenishes your blood. You're having your period during that time. We have the injectable, although we try to frown on it. And I think this is the one that has brought that story, especially the injectable where it's, you know, it's the one that has brought that story because yes, we know that that particular injectable, here we call it the depot, it may take longer for you to conceive when you're on that injection, the 3-monthly injection. Yes, it's possible to take longer to conceive. In some countries, they banned it. In some, we still have them, and especially here. And many women prefer using it. But what I would say is that if at all you have to use it, then it's better for those women who are done having their kids so that it doesn't take longer to conceive when you, because you're not intending to conceive anyway. So you can use it, And then when you're a bit grown, in terms of like you're above a certain, like you're done, you're getting kids, you're above
Yes.
35, so you have shorter time to use it before you go into menopause.
Yeah, right.
Because the issue is the fact that it makes the bones brittle if you use for a very long period of time. Yeah.
There you go. Side effects.
Yeah.
Okay.
The side effects,
Okay.
you can easily, have a fracture, but we don't give anything that is to harm you, because that's not what we're supposed to do. It's only that
Right.
it's still being banned slowly over the years, but it's been used for many years. So that's the one that probably would take longer, but eventually you can still conceive.
Right.
Yeah.
So that's
then
where
that
that
one-
fear,
Yeah,
where
that's
that
the
fear
one
comes
now.
from.
Right, so it now spreads to all the others, It's like, well, they'll just say contraceptives are bad, don't you? Don't
Right.
you? Yeah.
Right.
Same for this,
Right.
the one you put under the arm.
Yes.
The implant.
Yes.
When you remove it, you go back to your normal. You can still conceive immediately. The same month, you can still conceive. Yeah.
Oh.
So yeah, and then the patches. There are many others. There are patches that.
There are many.
Yeah. Those are
So really, in general, there is, besides the injectables, really everything else, as soon as you stop, you really can conceive a month to 2 months after.
Yes.
More highly likely.
Yes.
Yeah, because there's some, there are some people who feel like, well, I don't want to walk down that, lane, because hey, when we're ready, we don't want a situation where I have spoiled my system and I can't get pregnant. So it's so good that that's clarified. Sis, before we go, shall we talk about the truth of the matter? There are some sisters who are getting married in their menopausal, stage, in that life, okay? In their whatever, how, and by the way, there's some sisters who have menopause early. There are some sisters who have it later, so let's talk about that for the older sister, the older, are they called spinsters? So for that one that is in menopause, how can she prepare for married life? And it could very well be this is her second marriage. So she may very well have had kids. She knows what it is to be intimate with a man, but I'm guessing there'll be changes in her body, being menopausal and all that. Why don't you talk to that spinster who, may need, some advice?
Wow. It's I think we tend to forget this kind of group of people a lot, because it's a natural, it's like the way you pass through puberty. Now this is another stage all of us still have to go through it. Unfortunately, we rarely talk about it because we just hold ourselves together and just endure the pain and the things that it brings. I really understand women who are going through perimenopause and menopause, and you know why? Because there are many changes that happen in the body, and the reason is because estrogen level goes down. The hormone estrogen goes down because we're not producing eggs, and those eggs, when they're produced, they produce estrogen. So if there's no eggs being produced, then we're not having enough estrogen in the body. And estrogen is so important because it helps us to be, the way we are. When you have smooth skin, it prevents you from getting the acne. Of course, there are people who definitely get acne. Again, it might be because of other hormones like testosterone in their bodies. But it distributes your fat, into the hips, into the breast, So when you're below 35, your breasts are like, so powerful. I don't know how to say that.
Perky.
Yes, exactly. I was worried which would be like. And then when the fat goes away, then everything starts to change. So your hips are not necessarily the way they were. Your breasts have changed. Even your cheeks, they've gone down kidogo, or now I'm speaking Swahili, helps you have your natural secretions, the discharge that you have in the vagina. you know, and also allows the vagina to remain elastic and all that. So once estrogen is taken away, you know, in this, and it's expected because, you know, even our bodies need to rest after giving birth and all that. You know, it's only natural for it. You know, it's a method to save you from still giving birth even when you're in your you know, age that you don't want to conceive. So yeah, so what happens is that when that's taken away, then there's a lot of changes that happen to your body, and the ones that are really that bring, you know, women back to us, and which African women don't talk about, is the hot flashes. The hot flashes can be really, really crazy. You feel the heat coming up from your back to the neck, and you feel it's coming, you know, it's and then you're agitated, you're sweating, and then you're sweating where people are not sweating, and they're looking at you like, why are you sweating? Are you okay? You know, everyone is worried about you, or maybe they're not worried about you. And that bothers you. And that brings a lot of, you know, discomfort to be around people. For some people, they might be socially, they might even stop socializing with other people at this point. That agitation can also get to a point where you're arguing with your husband. And most of the marriages are affected at this point. Usually, if you look at the statistics, it's when these things are happening and changing at the same time, because you don't have your normal secretion that is expected in the vagina. Then you're dry, you're itchy, you're irritated, you don't want to have intercourse, your libido is out, you know. But it's good to note that there are people who their libidos go up at this time. So it just depends on who you are, how it is for you, you know. And this affects relationship, and, you know, all that's happening. People don't understand you. You're feeling hot when they're feeling cold. There's a lot of mental issues that happen. There's anxiety. There are people who are likely to get depressed at this time. Their hair is falling off. Because now your estrogen, which was giving you your hair in front, now you're having some form of balding, which you know, and you want, this is the time you should be enjoying your age, right? So if you're getting into marriage at this point, it's good to at least know, again, mental health. Are you okay? Is everything okay with me? Do I need to, how is my interest? Am I interested in, because again, sex is a very important thing in marriage, because you can have this kind of discussion with your partner as you plan. And I think it happens during the couples counseling for all ages, but at this point you need to talk about the things that are happening to you, because if you're having dryness and pain, you're irritated, you're itchy, then who's gonna have sex? They're just nobody's gonna have sex. And that's gonna create tension in marriage. Because what I have known is that men are, we find it very difficult to understand them. But sometimes the only thing that gives them problem is sex. Most of the time, you're just not giving me to, in Africa, especially our women here, is just either they're not conceiving or they're not, you know, women tend to leave. I don't know why they do that. It's very unfortunate. That happens. So almost all the time, the woman will be alone, going through menopause on their own, which is very, very painful. So let them have this conversation. Talk about the things that might make you feel uncomfortable, like maybe now you feel like you're not good enough, you know, those kind of things. Because your body has changed. It's changing, and it's a beautiful thing for your body to go through the normal process of life. And that's the thing we need to know about ourselves and appreciate ourselves every single day. And then if there's any issue at all, like let's say it's issues down there that you need to sort out, there are some ways we can be able to help you return some of the normalcy of the vagina, and also other things in your body, including the hot flashes, so that it can reduce, so that you can be able to have a good time. Again, it's good to maintain a good the beauty is that if you're getting into a relationship at this age, it's very helpful for you as well, because you're more relaxed, you have someone who's supporting you, you're new in this relationship, so it may work for your benefit.
For that spinster that's getting married and she's going through this, ideally discussion is important, like just to speak up and say, this is where I'm at,
going on,
and they're, like you said, their libido may not necessarily be high up there. For some it dips, for some it goes really high. And at this point they need to have this discussion, I guess, with someone like yourself as well.
Yes,
you
very
know,
important.
Because there's some things I guess they can use as well. Because when we talk about the dryness, that can be, how do I say that can be addressed, right? No?
Yeah, we can manage that, There are different ways we can do it.
Absolutely. Love that. Now, before we go, because we're going to bring this show now to a close, we wanted to touch on the guys, but we were not able to. But can you just, for the guys, maybe just say something to the guys? What can they do? Because I know I started off with the sisters, but let's see, what can we say to the guys that are looking to get married as well, again, who are just saying, I want to get married, I want a normal, healthy sex life with my wife. What can they do in prepping for that?
Reproductive health is not necessarily it's not just women. Reproductive health, we're talking about both male and female of different ages. As long as you're in your reproductive age, we will talk about it. Even before reproductive, we're talking about both male and female. In fact, whenever we say anything to do with an OBGYN, people believe that it's just women. But we do see men as well. Most of the time when we see men, it's anything that can be managed with medication. Medication being if you have low sperm count, we manage with medication, and of course other things in terms of if you want to conceive and we can't get any sperm at all, there are other modern methods we use like IVF and all that in our medical work. So that we do for men. Anything to do with anything that needs surgical intervention, that's when we do urosurgeons. Like we have surgeons who deal with the male system. Like if you have any issues with your prostate, no, that's not a gynecological issue. If you have to have any surgery, then it's mostly surgeons who do that. But anything medical, anything sexual dysfunction, also we manage that together. It's a multidisciplinary, so don't be afraid to come to or go and see an OBGYN, and then always join your partner when they're going to see an OBG, because some of these issues we deal with, like sexually transmitted infections, they're not transmitting themselves. A woman, it's sex. There has to be intercourse. So when and the unfortunate thing is that we treat the woman and then she comes back with the same thing, same thing, and we're like, why is this medication not working? So we have to ask the partner, where is he? Because well
this is the thing I was saying to you about the African culture. It's like, woman, go and get yourself fixed. You are always going to be the problem where reproduction is concerned. It's like and you find that there are sisters who are so fertile, so fertile. Like you were saying earlier, there are some people that they're so fertile that it's not even penetrative sex. They could just be whatever, hanging out at the courtyard. And they get pregnant. There was no penetration, but they got pregnant, right? Right? But it's always like it's the woman. But the truth of the matter is, men are very much so part of this equation.
Even cancers. Cervical cancer. It's HPV virus that passed from one person to another during intercourse. And so we're treating a thing that could have been prevented in the first place. How to prevent it? Either we treat both of you early, we need to do the HPV test on both. It's important because also men suffer from HPV related complications like throat cancer, anal cancer, all those. Most of them are HPV, and people don't talk about it.
I learned that from the live you did with Dr. Alexander Cohen.
Yes.
And we're gonna to have him soon, by the way. We're going to have him soon, by the way, thanks to you.
Yeah.
We want him to come in and talk to the guys for a little bit. And we're also going to talk about some of these things in depth.
Very
yeah.
important. Very important.
Amazing.
And there's also
love it.
Contraceptives for men.
Yeah.
We're
Yeah,
not
there's
talking
contraceptives for men.
Yeah, if you want a permanent, we have I didn't even talk about, it's because it's so many things about tubal ligation where we close both tubes for the lady, but there's also vasectomy. So men don't talk about it. They don't want to hear about it, especially here at our setting. Even doctors themselves are like, you know what, I'm not going to do that, and it's just perception. It's beliefs. And we should have more men who have done vasectomy to come and help, us talk about this, because it's easier to do, first of all. For a woman.
Listen, it's a thing out here. It's a thing.
Yeah.
Yeah. It's somebody says, why is Dr. K laughing at us?
Because
seriously.
Some of them don't listen. They don't. When it comes to this conversation, there's no. They're like, that's for women, but there are other options. What if your lady cannot go through surgery? Are you still gonna conceive and the conception is probably making her worse?
Right.
Then we look at you, because you're two.
Yeah.
We forget, like, OBGYN is not just one person. We're talking about two people. So it should be involved. I'm sure Kofe will talk about that. Also the fact that it's easier to reverse as compared to BTL for women. And there's no appeal apparently, which has not been taken up very fully in most countries.
Okay, for guys.
Okay,
there you go. There you go. That's going to be an interesting one. That's going to be an interesting one to have guys take a pill. There you go. Thank you so much, Dr. K, for being on here and enlightening us. And but I tell you what, seriously, let's think about how you're going to come back in May, because I wanted us to touch on genotype, the sickle cell anemia and all that, because there are couples who are getting married, and there's some things, earlier we started by saying how they can go in and get themselves checked out. Some of the things that they get to do is blood work.
Issues, genetics,
right.
Yeah, very important.
That my Adam, who's one of my contributors, she's not been here for a little bit, is very big on that sickle cell anemia, and we're going to try and talk about that one, because if these are things that people are aware of before they get married, they need to know. They really need to know. So, absolutely. Thank you so much, sis. Really appreciate you being on here, and God bless you. Asante sana.
Amen.
Just Baraka Tele. Thank you so much.
Thank you so much. Thank you for inviting me. It was an amazing conversation. Hope to have more and more.
We will. And
This
the next one, and a couple of, I want to say next one, because we're going to do something in May. Let's talk about May and see what we can do. And maybe, but as soon as I get a Kenya, we're doing one in Swahili. I'm going to be with I'm going to bring my kamusi and get all the dictionary.
I can join you for the Swahili one. I do Swahili, but only writing. Have too many in my head. Swahili, Kikuyu, Kaba, English. Let me just, I'll understand. But there are people
love it. Thank you, Doc. Really appreciate you, Dr. Muthembwa. God bless you, and we will speak again soon. Thank you, everybody. God bless you. Join us next week as we have the amazing Timmy Como talking to us about free will, especially those of you who ask this question. Well, God told me so-and-so is my husband, or so-and-so is my wife. What if they're not interested in me? Yeah, we're going to address that, because there's some people feeling heartbroken because somebody didn't feel the way that you felt. We're going to address that one. So catch me here next week, Friday, same time. God bless you. Dr. K, you've been amazing. On behalf of myself and even my contributors who are not here today, thank you, ma'am. God bless you. And Bye-bye, everybody. Bye.
Thank you for watching the Maggie Mugai Show. You can subscribe to get notifications for new videos on this channel.